Our thoughts and prayers to the family and friends. Michael O'Year is some of the reason why some of us stand here today. Ball to the family now. It's not something you probably think much about, but do you know that your liver is a key player in your body's digestive system? Everything you eat or drink, including medicine, passes through it. As Kenya joins the world to raise awareness about liver diseases and promote liver health this year, our health and science reporter Gloria Milemo tells us why doctors advocate for the need to treat this intricate internal organ right so that it can stay healthy and do its job.
Ann Loko, a resident of Nairobi, got a new lease of life 27 months ago. What manifested as a skin disease before progressing to other health complications would later see her diagnosed with chronic liver failure. Even so, before doctors could nail a definitive diagnosis, Loko says she had to undergo a series of tests to determine what was preying on her health that kept on deteriorating each passing day.
After scans and MRIs, they discovered that also my liver was very small, and then my spleen was very enlarged.
Like many patients diagnosed with end-stage liver disease, her doctor recommended a liver transplant, said to be key in prolonging and improving quality of life of patients like her.
My sister offered to donate part of her liver, so she donated about 60% of her liver.
This new lease of life is one that came at a high cost, explains Loko, who underwent the procedure abroad. Whereas her insurance offered some financial relief during her treatment journey, the cost of sustaining the new organ now remains a burden that patients like her have to shoulder out of pocket in a bid to protect the organ.
It's very expensive because the first year I did the transplant, I was spending about 50,000 per month.
Like Loko, Winnie Miano's diagnosis also took a while. She was diagnosed with fatty liver disease in 2016. Doctors attributed it to an excessive weight.
I started feeling just a bit fatigued, tired all the time, feeling like I have malaria. You know, those symptoms of like getting out of bed is a problem, muscles are aching, like that.
However, despite losing weight as had been recommended, her symptoms persisted, compromising the health of her liver further.
They did a lot of imaging and all that, and discovered that it was really serious, because most of it was really covered by the fat and it had dried.
Like many patients who are forced to undergo the life-saving procedure, finding a donor became her biggest nightmare.
At first, it's quite a shock to hear that you need a transplant, and what goes through your head is, who can give me a liver now?
Dr. Chris Opio, a gastroenterologist at the Aga Khan Hospital, explains that liver disease can be caused by several factors. The factors present differently in both adults and children.
Overall, you may have infections, and the infections may be viral, so you have hepatitis A, B, C, D, E. You can have other infections, for example, bilharzia or schistosomiasis. You may also have yellow fever. I think you've heard of yellow fever, and there were outbreaks. Even dengue fever can cause liver damage.
Experts say liver diseases have become more common than ever, especially fatty liver disease. Even more worrying is that symptoms of some of these diseases, like the fatty liver disease, often go unnoticed.
The liver is the biggest organ in the body, and for you to have symptoms, you need to destroy more than, say, 70% of it.
The liver plays a critical role in the human body. Doctors say it's the body's primary metabolic and detoxification center. In children, as explained by Dr. Juliana Muiva, a pediatrician and gastroenterologist at the Kenyatta National Hospital, liver disease may present in form of high levels of bilirubin, which presents clinically as jaundice.
It can also manifest in other ways, such as a swollen tummy and sometimes in bleeding disorders.
She also reveals that blockage of tubes in the duct that carries bile from the liver to the gallbladder, also known as biliary atresia, poses more threat to children. This condition that happens when the bile duct inside or outside the liver does not develop normally, she explains destroys organs in the body, starting with the liver itself due to circulation of bile in the body.
If they come in early, we are actually able to try and find a new conduit for the bile flow to be re-established.
She reveals that the facility diagnoses at least 30 to 40 children with this condition whose survival rate, she adds, is dependent on availability of a donor for transplant. Lack of a liver transplant for patients is also said to be among factors impacting on access to care for patients who require a liver transplant in the country. The liver is an integral part of the body. As Kenya joins the rest of the world to create awareness about liver disease, doctors recommend that you should limit alcohol consumption, maintain a healthy lifestyle, and minimize exposure to toxins, among other recommendations, in a bid to maintain a healthy liver. Gloria Milimu, KTN News.
Now, with the start of the low season,